Go.
Hi, my name is Scott Lawback, and I'm the Vice President of Sales at Cambridge Sound Management. Cambridge Sound Management is a manufacturer of sound masking technology, and we've been in business for 10 years and have worked with the Steelcase organization and its dealers for the past 6 years. We currently sell about and install about 200,000 square feet of sound masking systems through our partnership with the Steelcase dealerships nationwide. If you're not familiar with what sound masking is, it's a little bit counterintuitive type of technology, but it's really the addition of unobtrusive background sound into corporate or healthcare office spaces. The sound that we generate is much like airflow. If you walked into a space and you weren't aware of sound masking, you might hear it, but it would sound just like airflow from an air handling space. And the reason we add that kind of sound to a space is to solve two problems that hospital or healthcare environments and corporations face today, and that's the distraction of conversations in open office cubicle environments and the issue of privacy between private officers or between private offices and hallways. So the addition of sound masking technology reduces the distraction of conversations in the open office cubicle environment, thereby allowing people to be more productive and less distracted. And it makes conversations more private between people in offices or between two doctors' offices where they're talking with patients. And those are the problems that the technology solves. I'm going to give you a couple of specific examples, or I'm going to show you in an analogy, sort of a visual analogy. So the way sound masking works, if you can think of a dark room, I'm going to give a light example. So the light example is in a dark room, if you have a flashing light, it's very noticeable. Whereas if you're in a bright room with a flashing light, it's barely noticeable. So if you make a little bit of a leap of faith in your logic here and think about a quiet room, something like a library, a conversation is therefore very noticeable because the space is too quiet. Whereas if you think of a room that has a little more conversation or background noise in it, those conversations are less noticeable. So if you can, it's a little bit counterintuitive, but that's the way it works. If it's too quiet, conversations are more noticeable. If it has a little bit of background sound, conversations are less noticeable. In the healthcare environment, the issues are typically ones of privacy. Here's an example of trying to protect the right of people's medical information when doctors are talking about those cases in the hallway. The addition of sound masking makes those conversations less intelligible and therefore more private. And this helps comply with some of the HIPAA regulations that are designed to improve patient privacy within healthcare situations. Another example that's somewhat similar is the privacy of patient information from hospital room to hospital room. If a doctor's in talking to me about my medical condition and someone else is in the room next door, we both have the right, because of the HIPAA laws, to have those conversations about our medical information be private. So here's where we would put sound masking technology in both of those patient rooms in order to make those conversations about our proprietary healthcare information more private. A third area, which is slightly different, occurs at night in a hospital when it gets fairly quiet in the space. And at that point in time, the conversations from the nurse's station and other people in the hallway become even more distracting to the patients in their rooms. And what they find is that patients don't sleep as well at night because of these more obtrusive conversations and activity noises from the hallways and nurses' stations. So within the last couple of years, there's been the introduction of hospital surveys called the HCAHPS survey, which actually has a questionnaire that people fill out before they leave the hospital, and it measures the degree of satisfaction that they have with a variety of factors while they're in their hospital stay, which include the quality of the care they got from the nurses and the doctors, the pharmacies, the application of their medicine. But there's another line on there that asks about how quiet the space was at night, and therefore how well did you sleep because of that. And we typically see relatively low scores in that particular question when you compare hospital to hospital. As it turns out, by the year 2012, Medicare funding will actually be based on the quality of the survey results from these HCAHPS surveys. So hospitals are financially motivated over the next couple of years to improve upon a variety of conditions in the hospital, including improving upon the noise issue that happens at night that can make a big difference on whether a patient sleeps well or not. Now, I've talked about how sound masking gets used. If I can just take a minute now, we'll talk about the technology that's used to deliver sound masking. So all sound masking systems have somewhat similar components. There's a sound generating device and a network of speakers that get installed to deliver the sound to the space. The innovative part about the Cambridge Sound Management System is that we've introduced the first and only direct field sound masking system, which basically means our speakers generate sound directly into the hospital or office environment by placing them in ceiling tiles so that the sound gets dispersed directly into the space. That allows us to ensure that the appropriate sound masking spectrum and sound level are completely uniform throughout the environment. The whole goal of the company was to introduce a sound masking technology that improved the performance and simplified the implementation of sound masking relative to the way it's been done historically by placing speakers in a plenum. The other thing that we did to standardize and simplify the technology is to connect all of our speakers to the sound generating unit via standard data cabling with standard RJ45 connectors. And as you can see on the back of this, we basically take a cable, plug it into the in jack on the back of the cable, and then plug a cable going out that connects to the next cable. So it's a very simple daisy chain connection between from speaker to speaker to speaker as those speakers are laid out in the ceiling. I don't know if you want to look up, but there's an actual installation of a speaker in this room, which you can see at this point. Now, not every ceiling is a drop ceiling, so we have a variety of other attachments to allow you to deal with ceilings that might happen to be concrete or have wood beams or have attached to steel trusses. So we don't really care what the ceiling environment is. We have a variety of adaptive connectors to allow us to use our speakers in any kind of ceiling environment. Then the way the system is controlled is via a software interface that is accessible from any personal computer on the company's corporate area network. The system is our control unit is an IP addressable box, and on that box there's a server-based application, a network-based application that resides on the box and is accessible by any PC on the network. If I dial into the system, I can simply control the sound levels by going in and changing the sound, and that will instantly raise the sound level within that space. As you notice, there are different areas of the facility that are defined here. Here at the ITG facility, they have an area called CARE, which is their clinical care demonstration area. There's also an open office area and various private offices that are all controlled differently. In the sound masking parlance, these are called zones, and they just mean different areas within a facility that have different acoustic requirements, thereby having the need for different sound levels. There's also the ability to establish different sound levels between nighttime and daytime. The hospital is a good example of where that's important, because During the day, a hospital is a relatively noisy place. At night, it's a very quiet space. So we can actually adapt the sound level appropriately to both nighttime and daytime usage. So that's pretty much it, how the technology works. We have a lot of examples of where this has been installed. I'll mention just a few here. The other thing that's important to know is that we have a variety of control units to allow your institution to pick the right one to meet the functional requirements as well as the price point. So if you have a small space, we have a lower cost controller that allows it to be a cost-effective implementation. Or if you have a large corporate environment with multiple buildings, multiple floors, we have enterprise-wide versions of these controllers that allow you to meet the functionality and price point requirements of that. So whatever your size or whatever your complexity, we have an appropriate control unit for that. Wide variety of healthcare customers today that are using our system. Many of these are Steelcase dealer customers throughout the U.S., including St. Thomas Hospital, which is an example of where they put the system in so that it would improve the quality of the patient's sleep experience. And there is a case study that's available from your Steelcase dealer that documents that experience within that institution. I'll show you one other one, which is a flagship installation of ours at the National Institutes of Health in Bethesda, Maryland. This is a complete hospital-wide deployment of our technology with systems installed in patient rooms and hallways and doctors' offices, all with the intention of improving the privacy throughout that space, and also to give the facilities manager a way to manage that system from a centralized location through a network of QT Pro control modules throughout the space. So hopefully that gives you a good overview of what sound masking does, how it works, why it's important for both healthcare and corporate enterprises to consider today, and know that Cambridge Sound Management and your local Steelcase dealer can work with you to make sure that we propose and design the right system to meet your requirements. Thank you very much.